Good afternoon. My name's Lorraine, and I will be your student family nurse practitioner today.
Hi, I'm Tyler.
Nice to meet you, Tyler.
Nice to meet you.
What brings you into the clinic today?
I'm just here for a routine exam, annual exam.
Okay, so I'll be conducting your health history. Okay, I'll ask you some questions about social questions, go through a review of the body. You okay with that?
Yeah.
Okay. So starting off, do you know if you had any childhood illnesses?
I had chicken pox at some point.
Okay. Any measles, mumps?
Not that I know. No.
Did you get all of your childhood vaccinations?
Yes.
Does that include like your HPV vaccinations?
Yes.
Okay. Do you get a routine flu shot every year?
No, I've never had.
No. Okay. And have you gotten your tetanus shot in the last 10 years?
Yes.
In the last 10 years?
Yes.
Okay. Did you have any childhood broken bones, anything like that?
I broke a lot of bones.
But in your childhood?
Childhood, was told I broke my nose learning to walk. I broke something in my hand as a young kid, and then
Okay. But nothing that had any residual effects that are affecting you now as an adult?
no.
Okay. Personal history, do you have any history of asthma, hypertension, diabetes? Have you ever had any liver kidney issues?
No.
Okay. Have you ever had a blood transfusion?
No.
Have you ever been tested for tuberculosis?
Yes.
You have. When was that?
Oh, 10 years ago?
Okay. Why did they test you?
It was for a job.
Okay. And everything, how did the results come out?
Negative.
Did they do a chest x-ray on you for that?
No.
Just the skin test. Okay, wonderful. Are you currently taking any medications?
No.
Do you have any allergies?
Just seasonal allergies.
Okay, so no allergies to medications?
No.
Good. How is your exercise regimen?
Not as good as it should be, but I do exercise.
How often would you say you exercise?
3 times a week, 4 times a week.
What kind of things do you do for exercise?
I ride my bike, or I run, or lift weights.
Okay, great. So now let's kind of shift into going into your family history, okay?
Okay.
Your parents, are they alive?
Yes.
Okay. And how old are they?
My dad is 72 and my mom is 71.
And how is their health? Any major issues? Have they been diagnosed with any illnesses? Let's start with your dad.
My dad's healthy. He doesn't have any problems. And I think my mom's just on some medication for high blood pressure, hypertension.
Okay. So your dad, no issues with liver, diabetes?
No.
Kidney issues?
Not that I know of, no.
Okay, sounds good. And your mom, just the hypertension?
Yeah, as far as I know, that's it.
About how long has she been on medications?
Oh, I don't know.
Okay. Any history of mental illness in your family?
No.
Okay. Can you tell me about your grandparents? We can start on your dad's side.
My dad's side. My dad's mother died of a brain tumor. I think up until then she was healthy. And my dad's father died of liver cancer, and I don't think he had any problems before that.
Okay. And let's go to your mother's side, your grandparents on your mother's side.
So my grandparents on my mother's side, my grandma on my mother's side, she died of renal failure, and my grandfather died of I'm not sure what he died of. He was a smoker forever, so I would assume something associated with that.
Okay. Any history with alcoholism or anything in your family?
My mom's brother died of alcoholism, some complication or something.
Okay. And are there any other family members that had like a significant health history?
No, I don't think so.
Right. So we're going to move on to social history. Okay. Tell me about yourself. Are you married? Do you have children?
I'm engaged.
Okay.
I live with my fiance. I have a fur baby. I have a dog that I live with.
Okay.
I'm I'm a contractor and a custom fabricator.
Okay, that's your occupation?
Right.
Okay, great.
Um,
How is your relationship with your fiance? Do you feel safe at home?
yeah, I feel very safe at home.
Okay, you feel like you have a good social support system at home with her?
Yeah, definitely. She supports me through.
Okay, great. And your family, do you talk to them often?
Yeah, I talk to both my parents almost daily. My sister I talk to all the time.
Okay.
I have a great support system.
Are you from here?
No, I've only lived in Austin for 2 years.
Okay.
Moved here for opportunity.
Okay, great. So, how about you're talking about your occupation. Do you feel financially stable? Like you have the good financial resources?
Yeah,
You have the good adequate housing?
comfortable.
Okay. Tell me, do you associate yourself with any sort of religion or spiritual practice?
No, not at all.
Okay. Do you feel like you need any sort of religious or spiritual support?
No.
Okay. And as far as, your free time, do you drink, smoke?
I don't drink or smoke.
Okay. Do you use any illicit drugs?
No.
And we talked about your exercise regimen, but how do you describe your diet to me?
I try to eat healthy. I definitely eat fast food a couple times a month, but I try to eat healthy.
Okay. And water?
I drink a lot of water.
You drink a lot of water. Okay. Good. All right. So now we're going to go into just your basic head to toe.
Okay.
Any issues that you're experiencing with your skin, anything with your hair?
No.
Okay. How about your eyes? Do you wear glasses or contact lenses?
No.
Your ears, do you feel like you can hear okay? Do you have any drainage
Yeah, no problem.
coming out? Okay. No pain?
No.
All right. Now, your smell. Any issues with your smell, sinuses, congestion?
Only seasonal allergies. It comes and goes, but nothing terrible.
Okay. And as far as your dental health goes, do you wear dentures? When's the last time you went to the dentist?
It's been about a year, a little over a year.
Okay. Any pain in your teeth or gums?
No.
Any major complaints?
No.
Okay. Let's see. As far as your lymph nodes, I don't know if you're familiar with them. Do you feel any swelling, bumps in your neck, anything like that?
No.
Okay. Now, as far as your lungs go, okay, do you breathe okay? Any history of asthma?
No.
Okay. You don't have trouble breathing?
No.
Shortness of breath? What about when you're exercising?
I think everyone has trouble breathing when exercise.
But nothing that is causing you to feel faint, weak? Okay.
No, not at all.
All right. And let's see. As far as your heart goes, do you feel like you have any sort of irregular heartbeat, palpitations?
No, not at all.
Okay. Any issues with high blood pressure?
No.
And your exercise tolerance?
I push myself pretty hard.
Okay, good. And let's see, let's go down to the abdomen. Any issues with your bowels? Are you having regular bowel movements?
Yeah.
Okay. No episodes of constipation or diarrhea?
No.
Any nausea or vomiting?
No.
Do you have any hemorrhoids currently?
No.
Okay. Has anyone ever told you, or have you ever felt like you had an ulcer?
No.
Okay. Heartburn?
No.
No. Okay. You don't take anything as far as like gas acts or Tums for indigestion?
No.
That's wonderful. And you aren't of age for a colonoscopy, but for some reason, have you been told to get one in the past?
No.
Any diet restrictions?
No. Not at all.
Um, and as far as urination goes, any urgency issues,
No.
frequency issues?
No.
Okay. Are you able to have and maintain an erection?
Yes.
Okay. Any pain in your testicles? Okay. Let's see. So your joints, any stiffness in your joints?
No.
Okay. I forgot to ask if you've had any past surgeries.
I had, I broke my toe pretty bad. I had to have surgery on that in about 2000, year 2000.
How did you break your toe?
Motorcycle accident.
Okay. Did you harm anything else during the motorcycle accident?
I broke a few other bones, a couple other bones in my foot and my collarbone, but no surgery with those.
Okay. Any issues with the helmet?
No.
Have you ever heard of a doctor telling you that you had a traumatic brain injury?
No.
Okay. So, any issues with walking now?
No.
Or the joints in that foot?
No, everything's fine.
Okay. How about any other surgeries?
I had surgery on my ankle in 2008.
Okay. And why did you need surgery on your ankle?
Riding my bicycle, I broke my ankle. I had to put some screws and stuff in it.
Okay. Any major complications with any of these surgeries?
No, I was told everything went smoothly and I still run and everything's fine. So
Okay. So no need for, did you go to rehab for it? Are you still currently in rehab for any of these injuries?
No.
Okay, so they don't affect you now as far as your activities of daily living,
No,
exercise, your occupation?
Everything's fine.
Okay, good. Neurologically, is all your sensation intact?
Yeah, definitely.
Okay, so no tremors?
No.
Any history of seizures?
No.
Okay. How is your memory? Memory still good, intact?
Good as it can be.
Okay, great. Now, as far as mental health, any history or feeling of anxiety?
No.
Okay. Depression?
No.
Have you ever wanted to harm yourself or others?
No.
Any issues with sleep disturbances?
No, I sleep pretty good.
Any issues with excessive thirst?
No.
Okay. Has anyone ever told you maybe you have a thyroid issue, or is that something that possibly runs in your family?
Not that I know of, no.
Are you feeling like you have the appropriate amount of energy to go through with your occupation, keep up with your duties at home?
Yeah, I think so. Yeah.
Okay, great. All right. Well, then that completes our health history. Okay.
Okay.
And it was very nice to meet you.
Nice to meet you. Thank you so much.